Today we're going to demonstrate a MACI Arthro. This is using the largest implant. This adds a little bit more challenge. This is the largest implant used so far in the country. You can see here that we have a much larger trochlear defect than we previously shown on the videos. The key here is the cutter can be challenging to get in. You want to back up the cannula and pull it to the gutters to get it released and turned. You really want to focus on the top and the bottom of the defect. These are the hardest places to access and the hardest places to see, as well as the opposite side from where your scope viewing portal is. We have 3 portals: medial, lateral, and central working portal. We're using the circle cutting guide to get the edges, and then we'll use an ENT curette, which you will see. You can see my previous videos to see how we start with this defect. Again, each defect's different, each cartilage is different. Some preps are easier than others. You can see we pulled the cannula back a little farther than we normally do, so we have a little bit of fat pad that can egress into it. When you actually place the graft, you want to make sure that those are out of the way. But for working distance, given the size, we needed to pull the cannula back. So the ENT curette's been used on both sides. And then now we're going to do one final check. Again, I usually place the cutter in about 3 or 4 times to make sure we have a good line. I will dry run the V-shuttle to make sure that I have the angle that I want to place this graft. The key is to always place the graft a little higher. It's much easier to bring it down than it is to bring it up. We're using gel thrombin. Now the tourniquet is off to make sure there's no bleeding that will occur underneath the graft. And then a little bit of thrombin or Tocil as well to reduce the bleeding. Now we're going to put the Tocil on. And given the size of this graft, you're going to have to do a little bit of flexion to get the bottom and also keep it dry because there is some oozing that can occur when you put the tourniquet back up. So now we're going to lay out the graft again. Cell side is down. And we're going to do some fine tuning adjustments. If we like the top, which we do in this situation, we're going to let it dry for at least a minute or 2 before we flex the knee to get the bottom of the graft. Again, this is different than some of the smaller grafts that you can do with the MACI Arthro. So here we're going to gently check the edges, and we're going to continuously clear. If you get something on the scope, you can use this little tip to clean off the scope. That's one trick arthroscopically in the dry position. Now we're going to put a little bit more Tocil on the bottom, but making sure it doesn't get caught. And then we'll flex and extend the knee. Again, you may see some movement. It's usually not of the graft. It's actually of the Tocil that's over the top because we do a healthy layer. And you can see there is no pull off of the graft with range of motion. Thank you.